Good morning. So I'm back again, and I'm back on my life lessons idea. So yesterday our first talk was sort of about eliminating stigma and shame and loving others, and our second lecture was sort of how we as clinicians need to love ourselves, to take enough care of ourselves. And so I'm going to finish that up today with we need to love ourselves enough to be authentic, to show up as who we really are for our patients so that we and our patients can change. And so the talks come full circle. So the title today is, you want me to what? Strategies for behavioral change in the outpatient setting. So this was kind of a really big topic for me. I don't talk about this or haven't talked about it in a conference setting ever. And so I did a lot of learning, and it's a pretty big topic, so I hope I broke it down into meaningful pieces. I'm going to talk a little bit about the social psychology of change, and then some of the mechanics and some real world things you can take into your practices, perhaps, that you can use to help motivate your patients to make change, because it does matter how you break down patients' problems to give them bite-sized, more manageable pieces in order to make the change they need. So what we're all struggling to do is move from our nice little comfort areas where we've built a pretty little fishbowl for ourselves and one little plastic plant where we're happy as clams, but to move beyond that, to get outside our comfort zone, move into discomfort, and learn to live in the big bad ocean that is this world. Here are some pretest questions again. I think we're tested enough. Let's not make it that hard. Is wanting to change necessary ingredient to change? Of course not. Just like it's not necessary to want to go to substance use treatment in order to get it. So never let that stand in your way. What is modeling in terms of change? It is learning behaviors through observation of others performing that behavior, and techniques to elicit behavior change include goal setting, reattribution, social support. All of the above is the answer there. Okay, so a lot of us are sitting around, we feel comfortable. If it ain't broke, why we gotta change anything? Right? But the problem is we tend to get stuck in the patterns we run, and we don't realize that they're dysfunctional. You don't realize that you're sitting at the door pushing when you need to be pulling, and how do you get out of that rut? And of course, we're probably all guilty of this, the magical thinking excuse. How about if I just sit here? I'm pretty sure things are going to change, right? Insanity, the definition, change nothing in yourself and expect the change to come. That didn't come out quite right, but you get the gist. I myself am guilty of magical thinking. After sort of 18-month battle with cancer, 6 months into recuperation, I sort of decided, okay, well, that 25 pounds, I'm probably the only person who went through 22 rounds of chemo and gained 25 pounds of ice cream weight. But I decided, like, okay, it's time for things to change. Like, I got to get back out there. And my first thought was, well, I've never been overweight in my life, so it's probably going to go away. I'll just wait it out. Right? That's a bit magical, right? Because unfortunately, those 18 months, 2 years that I had cancer, right, I became menopausal. And then they handed me a bunch of medications that made me sort of predisposed to weight gain. And that weight wasn't going anywhere until I got off my Tookus and moved myself around and stopped shoveling the ice cream into my mouth. But I was completely on board with myself about, I'll just wait and see. Like, I'm pretty sure it's going to go back to the way it was. So I get the magical thinking side of things. But why do we need to change? Well, from a health statistics standpoint, modifiable health behaviors contribute to an estimated 40% of deaths in the US. That's a lot. The CDC estimates that eliminating 3 risk factors, poor diet, inactivity, and smoking, would prevent 80% of heart disease and stroke, 80% of type 2 diabetes, and 40% of cancer. So if I hadn't have been woken up to the idea that I needed to get moving again, this statistic certainly got me off my ass. Sorry, I'm sorry if that was too forward. Chronic diseases are the leading cause of death and disability in the United States. 133 million Americans, approximately 45% of the population, have at least one chronic disease. They are responsible for 7 out of every 10 deaths in the U.S., killing more than 1.7 million Americans every year. By 2025, half of our population, 164 million Americans, will be affected by a chronic disease. And you can imagine what the healthcare costs for that are. And they amount to about $6,000 annually, which is 5 times higher than for those without a chronic disease. Obesity is costing the U.S. approximately $13 billion annually. That includes the extra cost of health insurance, sick leave, life insurance, and disability insurance that's associated with obesity. And more importantly, and sort of at the heart of all this, is that really change is good for you. The only constant in this world is change. If you are not changing, you are not growing. So you need to do it because it increases your brain's ability to be flexible, to think in different ways, to adapt. It builds compassion, pushes your boundaries, opens your mindset, improves your connection with others, and expands self-knowledge. And if we flip the coin, a lot of us sort of tend to fear change, right? Oh my God, I gotta change, this is gonna be horrible, right? Every time we get a new message from our chairperson that's like, and we're gonna start this new thing. I mean, I myself am like, oh my God, I can't even, this is gonna be horrible. I'm never doing this. I can't believe they want us to do one more thing. That sort of mindset doesn't help. You have to flip the coin and be like, you know what? Who knows? Maybe this will be awesome. And if it's not, we're going to trash it anyways. We're people who make up our own minds and do what we want to do. That's the nature of our profession. So why are you so, why am I, why are we so threatened by it? We shouldn't be. It's fun. When you change and something good comes out of it, that's motivating you to move further and be better in your life. Okay, so why is it so hard? If it's so good for us, why don't we just do it? Why aren't we like little generators for change? And I'm sure there's some people in this audience who are, but I am not one of them. And so I think the answer lies in some of the research that's being discussed by Dr. Brené Brown. Is anybody familiar with her? Okay, thank goodness there's at least a couple of you. I think she is telling what we all need to hear day in and day out. Her book, Daring Greatly, if you haven't read it, is one you might want to pick up. It's fantastic and looks at sort of the social psychology behind change and vulnerability. Now, she's been doing this for about 20 years. I'm going to try and encapsulate her research in about 5 minutes. So forgive me if it goes awry for anybody who's knowledgeable about it. And if anybody isn't, I hope this can be a little turning point for you to maybe get interested and what she does and why it's important for what we do. So you can choose courage or you can choose comfort. You cannot have both, right? That's where Brené Brown's starting point is, and it's really the truth of all our lives. Change, again, is important, but it requires that we engage in our lives from a place of worthiness. And that wouldn't be so hard if it weren't for the fact that we live in a culture of scarcity. A culture of never enough, never good enough, never perfect enough, never powerful enough, never smart, successful, safe enough. I wonder, when you woke up this morning, how many enoughs ran through your head before your feet hit the carpet out of bed? Oh my God, the alarm goes off. Oh, I didn't sleep enough. Oh my God, there's not going to be enough time to get to the first lecture. Oh my God, I didn't pack enough food in the refrigerator to have breakfast before I get there, right? The cycle is endless. Scarcity is a never enough problem. It thrives in a culture where the hyper-awareness of lack abounds. Everything from safety to love to money to resources feels restricted or lacking. And it thrives in a shame-prone culture, those steeped in comparison and fractured by disengagement. So scarcity has 3 components: shame, comparison, and disengagement. Shame is the fear of ridicule or belittling used to manage people or keep people in line. I mean, I don't want to get political here, but we don't have to look that far to find examples of shame, ridicule, belittlement. in our society today. Comparison. Now, I'll agree that healthy competition is one thing, but is there a constant overt or even covert comparing and ranking? Has creativity been suffocated? Are people held to one narrow standard rather than acknowledged for their unique gifts and contributions? The more that one narrow standard takes over, the less room there is for all of us to feel comfortable with our differences. And disengagement. Are people afraid to try new things, take risks? Is everyone struggling to be seen and heard? In this culture, right, nothing flourishes. So choosing to do something different is challenging in this climate and requires that we branch out. We try something different. It requires that we're willing to own our own authenticity, to embrace our vulnerabilities, and engage in the world from a place of worthiness. If we start believing we're enough, it gives us permission to remove the mask and armor we've built around ourselves and embrace worthiness, boundaries, and engagement, which are the antidotes to the scarcity culture. We need to move away from the idea that vulnerability is weakness, that being too vulnerable or perceived as too emotional is a problem. Who cultivated the idea that sucking it up, soldiering on, and masking our feelings was a mark of being strong and good? It's not. It's a cover-up. We've come to a place where rather than appreciating the courage and the daring that it takes to be vulnerable, we let our fear and discomfort become judgment and criticism. We've confused feeling with failing and emotions with liabilities, where vulnerability is the birthplace of love, joy, belonging, courage, empathy, creativity, all the things that we need to pull ourselves out of the downward spiral we seem to be headed towards. If we want greater clarity and deeper purpose or meaning in our lives, then vulnerability is the path. Vulnerability is courage. And from a health perspective, we know that behavior change will not occur unless we acknowledge our risks and exposure. We're more at risk when we don't acknowledge where and how we're tender. But vulnerability is so difficult. I hate it. I do. I speak on it, and I'm telling you I don't like it, especially in personal relationships. I don't know if it's where I came from, how I was raised, my medical training. It's probably all of the above. But I don't like to not have the answer. I don't like to cry. I don't like to be like, oh, I don't know. Well, guess what? I don't know all the time. And I should be crying more. And I'm going to work on it. And so maybe that will give you guys some of the impetus to try it too. So unfortunately, when you grow up in a culture that doesn't value vulnerability, we learn to hide it. And how do we hide it? What are our vulnerability shields? Well, Brené Brown says they're foreboding joy, perfectionism, and numbing. So what does that mean? So foreboding joy, I love this. Foreboding joy is the constant disaster planning strategy, like a continuum between rehearsing tragedy and perpetual disappointment. So in perpetual disappointment, you sort of live in the doldrums. You're in the gray clouds. It's never super sunny, but it's also not a derecho. You're hanging in there. But what happens is you sacrifice joy, but you suffer less pain. I mean, what kind of strategy is that? And yet we use it all the time. Or how about perfectionism? Like, that's me. Hello, I'm in the perfectionism category, and she has a nice phrasing where she says she's a recovering perfectionist, aspiring good enough-ist. That's what I'm going for. That's what I'm doing today. I'm just going to try to be good enough-ist. It's the belief that if we do everything perfectly and we look perfectly, then we can minimize or avoid the pain of life, of being blamed, of other people's judgment and shame. But the problem is it's a defensive position. It's external focused. When you're doing things to avoid other people's judgment, right, that's not doing things to improve your own condition. So it will never work. It's a hustle. It's other-focused, whereas healthy striving, healthy change is self-focused, is generated from inside. And numbing, right? So obviously substance abuse sticks out here, and that's speaks truth to my personal experience and also what I do in my work, but one of the most universal numbing strategies, which I'm sure is familiar to a lot of people in this audience, is the crazy busy numbing, right? We're a culture of people who've bought into the idea that if we stay busy enough, the truth of our lives won't catch up to us, right? We'll just keep going, keep going, keep going, keep going. But you can't selectively numb emotion. You selectively numb one, you almost always selectively numb them all. Numb the dark, you numb the light. Numbing is also sort of taking the edge off. How many of us are guilty of having a very long day at work? We come home, we have 1 or 2 drinks. God, that feels good, right? That's not good. That's not living in the truth of your feeling. And there are anecdotes for these vulnerability shields, and they include gratitude, appreciating the ordinary moments, savoring them, being grateful for what you have. And we talked a little bit yesterday about what gratitude can do for you and simple tasks you can do to bring gratitude into your life. Gratitude lists, a gratitude picture journal in your phone, gratitude letters. And there's an antidote for perfectionism, and it's appreciating the beauty of cracks, moving from what people think should be enough to self-compassion, self-kindness, common humanity, and mindfulness, which we also mentioned yesterday. And the antidote for numbing, I spend a lot of time talking about this with my women who have substance use issues, is actually learning to feel your feelings. About being okay feeling crappy, about saying when someone asks you, how are you doing, not reflexively answering, I'm good, it's all good. Being like, ooh, shitty day today, or not so good for me, or I'm doing all right. Or if you're good, be like, hey, I'm good, how are you? You need anything, right? Like, it's actually living the truth and learning to lean in to the discomfort of difficult emotions. So that's sort of social psychology around how change affects us, and how if we are not vulnerable and authentic, I think, how can we ask our patients to do the same? So I'm not in favor of indiscriminate sharing of your lives with your patients, but I am in favor of them letting them see some of your difficulties in moving through your own life. I think it was very fortunate for me that I got cancer right in front of all my patients. They watched the hair fall out. They watched me turn into a pumpkin on steroids. They watched me drag my butt into work, barely able to stand up from a chair during my chemotherapy. That really helped them see over the course of 2 years what it means to be fragile and what it means to build back up. And I don't know that I could have shown them myself, my internal struggles, in a more eloquent way than what cancer did for me. And for that, I'll be grateful to cancer, and that's about the only time. It's important that we practice the values we hold as important for our culture with our patients. And by embracing our own vulnerability, we make it easier for our patients to manage their own shame and discomfort. She does have a leadership manifesto. If you read Daring Greatly, you can see it, but it gives some idea of what we should strive for as people who are leaders in our communities and in our healthcare systems. Okay, there are behavior change theories. They're sort of long and involved and complicated, and I have to tell you, I spent hours reading about them and I still don't really get them. But let me just tell you the upshot is that attitudes and behaviors impact human action, right? That was a pretty good summation of hours of work, right? So the most common theory of behavioral change is a trans-theoretical model, or the one by Prochaska and DiClemente that talks about an individual's readiness to change in one of 5 stages, right? That's the pre-contemplation through to maintenance and relapse that we probably all hear about, is most heavily used in substance use disorders, but it really can pertain to nearly every strategy for change that you have. There's the theory of reasoned action and the theory of planned behavior, which suggests that behavior change is determined by intention to perform a behavior. So your attitudes, your intention predicts how individuals will behave. Your perceived control changes whether or not you will actually try to engage in a behavior. So if you have a more positive attitude or a positive subjective norm about some change you want to make, you will have greater perceived control that making that change will help, and that will increase the likelihood that you will actually take measures to, in fact, make that change. So there's some stages of change models. As I said, stages of change can be applied to nearly everything. I gave a more written out method in case some of you in this room aren't familiar with it. It can be applied to exercise. It can be applied to eating. It can be applied to nearly every major smoking cessation, every major strategy of change we need. There's the health belief model, which says that changes are made based on the perception of severity of potential illness, susceptibility to illness, benefits of changing behavior to prevent or reduce the effect of illness. So it basically talks about how individual beliefs about health conditions predict individual health-related behaviors. It's a little complicated graph that we probably don't need because it doesn't pertain to you daily. And then the social cognitive or social learning theory looks at the influence of individual experiences, the actions of others, and environmental factors on individual health behaviors. So let's talk about some strategies for change. There's definitely evidence-based work about how to help your patients make change, so I'm going to provide some of that here, but then I'm going to finish up the lecture talking a bit about sort of just helpful tips you can use, so sort of discrete things you can do to help talk to your patients about how to make changes in their lives. So in terms of, let's go back to strategies for change. Your life does not get better by chance, it gets better by change. That's the truth. And one day, or day one, you decide. I say that every day to someone in my office, right? Because you don't need, it doesn't have to be a special day. You don't have to have woken up on the right side of the bed and everything gone right and your egg didn't break when you cooked it in the morning for you to decide that today's the day you're going to make a change. Just do it. Just start today, right where you are, something teeny. Don't make it big, you won't make it. We'll see that later. So strategies for change, evidence-based, include motivational interviewing. So motivational interviewing or motivational enhancement therapy is a type of therapy that focuses on an empathetic style of interviewing and works to reduce maladaptive behaviors and promote healthy adaptive behavior change. Its job is to encourage anyone who's thinking about change to take some initial steps to make it. There's a lot of data around motivational interviewing in substance use, but it's also in smoking cessation and obesity. And in general, when we talk about motivational interviewing, people generally use the frames mnemonic, which means if your patient comes in and they say, I'm drinking too much, Dr. Wells, and I think I need to do something about it, then you go down your frames mnemonic and you say, well, talk to me about how much are you drinking? And they say, well, I drink 6-pack, 12-pack a night. And my feedback on their impairment or risk would be like, well, hey, that's higher than the American Medical Association would say is healthy for a person of your age. And we know that drinking can have a number of negative health benefits, so maybe it sounds like it's a great idea you want to cut down. And then we ask about their personal responsibility for change. What changes are you willing to make? What does that look like for you? Clear advice to change. How many of you know that if a doctor tells somebody to quit smoking, they're 20% more likely to quit smoking over the long term? I know that. But so I say it all the time, in case you need, I say it to my patients, in case you need to hear this from a physician, smoking isn't good for you. Drinking isn't good for you. Meth isn't good for you. Heroin, not good. In case you didn't know. But I give them clear advice. Okay, let's talk about some of the things we can do. You want to give them a list of alternatives. And it's important that your style is empathic, right? That you're listening. A big thing in motivational interviewing is a role with resistance, right? Oftentimes patients are stuck. They don't know. They want to change. We're scared. I don't know. Maybe it's fine. I don't need to do anything with it. And your job is to be like, okay, well, maybe you don't. Let's make a list. How about some pros and cons? Like, what made you think about it in the first place? Or what drinking, I'll get it out. What benefit has drinking been to you? What space does it occupy in your life, right? Like, allow them the room. I get hung up sometimes. I get really frustrated with the women in my opiate use medication-assisted treatment group who relapse consistently, right, over and over again, even though I know that's the nature of the disease, but I sort of get mad. And that is contrary to everything we know about helping someone change. It doesn't work. You have to be like, hey, I'm sorry that's going on for you. What can we do to help you change? The anger, the rebuke from their physician doesn't help, right? A lot of my patients, knowing that they're substance use disordered women, look at me as a parent. They don't need to be shamed by their parent, right? They need open empathy. And we want to facilitate self-efficacy. Let somebody know, like, hey, you can do this. Let's start small, something easy. There's the 5 A's, another evidence-based strategy that incorporates MI to address behavior change in smoking cessation. Ask, advise, assess, assist, arrange. These are all in here so that if you want to use them or refer to them later, you can. 5 A's is used in obesity as well. There's the readiness ruler, which is also sort of based on motivational interviewing, but it's really pretty handy because you can use a ruler in your office. If someone wants to make a little change, you pull out a ruler, you say, hey, 10 is complete and total alcohol cessation, and 1 is drinking till you're blacked out. Where are you on the readiness for change scale? How many drinks would you like to cut down on? Right? You ask them, what are they considering? It's sort of very similar to MI, but it's a very simple strategy to use in your office when you don't have a lot of time. Another thing that has been shown to be of benefit is creating an action plan. An action plan is a plan for change created together by the patient and the clinician, and it outlines 1 or more easy steps to obtain a health goal. It has been used to implement dietary changes, stop smoking, increase physical activity, reduce stress, improve sleep habits, and learn to increase medication compliance. So that's what an action plan looks like, and you can see it has room for the name of the patient at the top and the signature of both the patient and the clinician at the bottom. And it sets out a series of activities that you can choose to change, how confident you are that you will change them, and sort of the specifics of the change you'd like to make and in what time period, because discrete changes require that you set careful limits. So other evidence-based interventions include SMART goal setting, problem-solving barriers, self-monitoring, physical activity prescriptions. It works just like it works that physicians tell patients, hey, in case nobody told you, smoking is bad for you, right? That helps people quit. It also helps people if you write on a prescription pad, exercise 3 times a week for 20 minutes. It's not that hard. That helps them. Easy, simple thing you can do in your office. Healthy eating goals. You can use the healthy plate method, which we'll see in a second. Brief behavioral therapy for insomnia, I think is largely, it might not be. Do you guys ever use that, brief behavioral therapy for insomnia? Anybody use it? Okay, I think maybe it's in the purview of psychiatrists most of the time. Education on medication adherence, same thing. Stop smoking, exercise, take your medicines as I prescribe them, please, right? Them hearing that from you does help them improve their chances of change. And then the 5 R's is used for quitting smoking cessation. They're all evidence-based, and that's what some of them look like. So SMART goals is about setting strategic, measurable, attainable, relevant, and time-bound goals. Self-monitoring is picking a health behavior to focus on, like recording everything you eat in a day. It's built into a lot of health apps. It's built into Weight Watchers. It's built into MyFitnessPal. It's built into every single one. You keep a detailed food journal, you weigh yourself at a specific time, and you record your exercise. There's the healthy eating plate method. I keep this just in my office, just to print out, so patients can see that's what your plate should look like. I think it's very helpful for them. A lot of my patients have very little education about what healthy eating is. They are fast food connoisseurs in this fast-paced, ever-busy world. They think they have to eat McDonald's all the time, and we do a lot of education about what a healthy meal looks like, because I'm mindful that the women I care for are also mothers. There's the 5 R's that we talked about for quitting tobacco. There's a complete list in case you want it and want to refer to it in the after this is over. Okay, so how do we get change that sticks? I mentioned that lots of theories, the social psychology, but let's get to the nitty-gritty. Like, what are the things you can do in the 5-10 minutes you have with your patients to help them make change, to help them set themselves up for success? So here are my top 10 tips. You gotta teach your patients to focus on one behavior at a time. So every New Year's, I think we all get an influx of people who are quitting smoking, stopping drinking, and bought a gym membership. So the likelihood, I'm like, yay you, like I don't wanna, you gotta roll with resistance. Well, that's something, right? But you have to reflect back to them like, that sounds like that might be hard for you to get all that accomplished. How about we pick one of those right now, and then when you get that one under your belt, then we'll stick up to the next one. Because we know if you're running, trying to change too many things at one time, you're likely to use the conflicting change patterns to hurt your overall success. So, for example, you want to stop drinking and get skinny. So what will happen is you have a really great day of eating and you record all your food and you feel really great and you get home and you think, you know what? I did so well today. I'm going to reward myself with a drink, right? It's like universal. And so you so you have to choose one thing at a time. You have to break it down. Trying to change too many behaviors at once leads to fatigue, cheating, and disappointment. And you got to write it down. Nobody wants to write it down anymore. We got to write it down. Hold you accountable. Put it in your phone. Make a list. We talked about weekly and daily and dream bucket lists yesterday. Put it on the bucket list. Pick a behavior you have full control over. You cannot control other people. So I have a hard time when lots of people want to change their work environment, or they're like, I hate my boss. I'm going to make him see what a good worker I am. And I'm like, oh boy. We need to sort of reframe that, right? Like, you can't change Jack. You know what I want to say right there about him. Your boss is going to be your boss, but you can control how you respond to it. If you don't believe it, if it doesn't hold water, then it's water off a duck's back. Then move on. Someone can say whatever they want about you. If it is not the truth, it will not stick. That is my experience in this life, and I really think it holds true. So I try to encourage people, look to yourself. Everything about change is internal, right? We talked about that external, perfectionist, other-focused change is a hustle. It's not real. So you have to be very careful when people suggest change, like in the workplace in particular. I think that often has to do with outside stressors, and you have to ensure that they're focused on, like, you can change the environment in your personal office, right? You can choose to put on classical music when you're trying to relax. You can get a diffuser that smells really good that helps you respond. You can take 5 minutes in your office to do a deep breathing exercise like the kindness meditation we looked at yesterday. Those are all reasonable things, but trying to make your boss see how well you're doing is not going to work. Identify your motivation. If the reason for change isn't important enough to you, then you're not going to make it. And you have to be honest with yourselves. Everybody knows the catchphrases, right? I'm going to quit smoking. I'm going to go to the gym. I'm going to lose weight. Like, it rolls off our tongues, but if you don't really want to do it, like, do you want to quit smoking for your kids? Because we know you're going to die earlier. We don't know when, but sometime, and it will be earlier than your natural life trajectory. So How about be alive for your children? That might be a great motivator. Or are you losing weight so you can look like the chicks in the magazines we all pick up at the newsstands? Not gonna work, right? It has to be internal focus. Like, I just need to be healthier. When I came out of cancer and I was 25 pounds heavier, I thought, oh my God, I can barely move. Like, it was hard to get up from a chair. And I thought, like, this is not the person I want to be. I do not want to grow old being unable to move. I'm going to have a cane in like 5 years. That's disgusting. Like, you got to move it, right? But that internal focus really gave me the motivation. And so it really helped. And I'll just do this. This is a little selfish of me, but like, I used to, literally, I could not stand from a chair. So if I went like this, I could not stand up. So I'm just here to tell you that change works. From a weight loss perspective, I should be honest, I still have only lost 10 pounds. But let me tell you, I've been going to the gym every other day for 13 months now, and it matters. And you can do it because I did it, and I could not move, and I did it. So you can too. It's just slow. We're in the long race. We are the turtles. I love hares, God love you, but I think that was for like 20-year-olds. I am closing in on 50, and I'm in the hare section of the race. Okay, so motivations we learned in the social change theory are important predictors of our behaviors. So if we don't have enough motivation to change, we're not gonna do it. And part of identifying your motivation is looking at what stopped you in the past, identifying your past obstacles and new triggers for failure. And a lot of articles will suggest that for every past obstacle or for every trigger you identify a positive behavior you can do instead. We all know this, the I'm gonna lose weight, clean out the pantry model, right? You're gonna be a lot more successful in losing weight if you come home to a pantry that supports your ability to lose weight. If you come home and there's 6 pints of ice cream and 4 boxes of Oreos and some goldfish, 3 pounds of pasta and a leftover pizza in your fridge, you're probably not gonna be able to stick to it. Instead, change things up, get your family on board, buy some new groceries, right? It will help. You've got to pull people from your support system in, and we'll see that later. So you purge the urge, right? You get rid of all those things that stand in your way, and that often also means social contacts. Smoking is an incredibly social activity. Drinking, incredibly social activity. Eating, incredibly social activity. And we are social creatures. We need to be social. So you have to build that in. You either got to find new people who are going to help you achieve your goals, or you got to bring the old people into your strategy. Recruit them in. Get them on Weight Watchers. Help them come to the dark side of healthiness. Okay, you want to do your research. It actually does matter. Knowledge is a key predictor, a precursor of change. Learn about the specific benefits to you. My risk of cancer is reduced if I lose weight. That's pretty major. I'd like to live. I don't really want to die, so at least not yet. It will happen some point. So it was important to me to learn. I can actually reduce my risk by keeping my weight lowered. If that isn't a reason to try to stay thinner, I don't know what is. Give it time, right? Remember those 5 stages of change? Sometimes we slip down a step. Sometimes we climb the steps too fast. Sometimes we fall off the steps altogether. And then you just get right back on. But it takes time. You have to be patient. Like I said, it's better to be in the long game. It takes a long time for effective change to take hold. I know Oprah has the 21-day rule. I think there probably is a little bit to that, but doing a habit, do you know that? Doing a habit every day for 21 days helps cement it into your daily routine. I think that actually does help, but I'm going to tell you 2 years is a whole lot better than 21 days. Ask for help, right? Healthy behavior is a team sport. Do any of you have like healthy behavior apps as part of your hospital communities? We do. Really, so our entire hospital system, if you download the app, they give you a Fitbit, and you can compete as teams. As departments, so psychiatry can compete against OBGYN, can compete against cardiovascular medicine to do things, or you can just make groups of teams with your friends, right? But it really helps. You can measure, because your Fitbit is recorded, it all gets recorded. You get special bonuses, incentives, you get gift certificates. You can buy cool stuff in like the sports store. It's kind of a neat idea, but it encourages everybody to be on the same page. I feel like even in the last 2 years, the discussion around the water cooler has changed from like, you know, pizzas and donuts to like, oh my God, how'd you do in the fitness challenge? Like, oh my, I saw so-and-so won, that's so cool, right? It helps. Asking for help increases perceived control, right? Nobody is an island. I just said we're social creatures. We really need to use each other to help build the environment that creates an atmosphere so change can occur. Clean the pantry. Clear out that extra room and bring in some gym equipment. It can cost as little as $5, $10. Go to Walmart, get you some weights and a little mat. It doesn't have to be the Peloton. Although the Peloton is bitchin'. But I'm just saying, you can do it for little or no money. Declutter a room. Bring your serenity to a specific room. That can be a place of mindfulness, of meditation. I have a space in my house and it's just a little corner of a room, but it really works. Manage your self-talk, right? Have a mantra. I've had a mantra since college, feel good, look good, do good. That's my deal. So I try to incorporate that into everything and manage my self-talk all the time. I'm like, oh my God, you've gained so much weight, you look horrible. Does that help? It does not. So you have to try to turn it around like, hey, 10 pounds is no small measure. I got some chicken. It was like 2 pounds and I thought, 5 of these, that's not bad, right? That's like changing up the self-talk. Find your tribe, join social health challenges. So like I mentioned, my hospital system has it, but tons of social media has it. MyFitnessPal has it. Weight Watchers has it. There's one, Kayla Itzinas has it. I mean, there's probably a million. They're all designed to bring communities of like-minded individuals together to promote healthy change, and that's what you need. Visibility increases accountability. It helps that my colleagues at work, where I spend a large portion of my time, know that I have worked hard for the last 6 months. It's heartbreaking, I'm here to tell you, to cut down the amount of Coca-Cola I drink. I think Coca-Cola is the elixir of life. I have since I wasn't allowed to drink it as a child and I got to college and they had a fountain. And I thought, my life has been made. And since that time, I have shared a deep and abiding love affair with Coca-Cola. I'm not going to break into that small period of time where we broke up, and I might have dated Pepsi. Don't even talk about it. It was bad. It was bad. It ended terribly. I went back to my steady and steadfast love, Coca-Cola. But since the new year, since I knew I've been going to the gym for a year, I've lost 3 pounds, I was like, this is not working. The Coca-Cola has to go. We all know it. So I have gradually decreased. I used to have, I'm embarrassed to say it, but I'm just going to put it out there because, I mean, it's real. 2 a day. 2 Cokes a day. I know, it's not so bad, but I mean, they're real Cokes. I'm doing real Cokes. That's like 32 teaspoons of sugar. That's pretty despicable. So 2 Cokes a day. I went down to 1 a day, and now I am down to 3 a week. And I know. And I even have these women I went to high school with who've sort of been my lifelong friends. We talk once a month. We FaceTime with each other. We live in different parts of the country. We call it Chick Chat. We have T-shirts that say Chick Chat. Yes, we're that gay. And we talk about how our month has been, and we each have like a strategy for change goal. I can't make this up. I mean, it's really true. Even before this whole lecture thing came up. But so my thing has been, I got to cut down the Coca-Cola, and it works, right? So the whole point of this diatribe was about increasing accountability. Let people help you. My colleagues at work know They're like, oh, if I have a Coca-Cola, they're like, oh, Dr. Wells having a bad day. Back off, right? Or I try to tell them, like, if you see me, if I'm jonesing, I try to, like, speak up, like, oh my God, I so need a Coca-Cola, don't let me have it. And then my MOA will be like, Dr. Wells, would you like some healthy Crystal Light? And I'll be like, God damn it, no, but all right. Pour it up. Okay, work towards small and attainable goals. We cannot try what we think we cannot do. So when someone comes in on the first of the year, well, it's probably the second, because hopefully we're all off one day a year. Come in on the second, they're like, I'm going to quit smoking, I'm going to lose 100 pounds, and I'm going to sleep 8 hours every single night. Try and scale that back. Let's take one goal at a time. Unrealistic and overambitious goals increase fear and anxiety in the long term and act like bombs to our accomplishments. We need manageable, discrete goals. I'm moving 5 pounds at a time, people. 1 Coke at a time, 1 week at a time. That's the only way that I found it manageable, and that's what the research supports. You want to create past positive experiences, right? So when you do something like, holy cow, I went from 2 Cokes every day to 3 a week. It's major, right? That's something I'm super proud of. But being able to do that helps fuel my desire to do more and increases my sense of self-efficacy. I can change things, and so can you, and so can your patients. And celebrate success. Don't forget to stop and appreciate and reward your incremental goals. I'm a Nordstrom's girl. Every 5 pounds, I do believe, I treat myself to a little something at Nordstrom's, and I feel good about it. And you too should do that, and your patients should do that, and your treats can be very small, or they can be cars. I don't care, just do it. Like, celebrate, right? That's why we're here. I made it through cancer. Right after I got cancer, my mom got cancer. We both have made it through cancer, and you better bet your sweet bippy. In 6 weeks, I will be on a plane to Africa to have the trip of my life, and I could not be more excited. And you want to share with others, like I'm doing here. So share your triumphs, share how you're changing, because that in and of itself can help motivate others to make those changes too. And that's it.